welcome back to PT in the Making. Today we're going to talk about, I don't have it written up here, but we're going to talk about traction. So now we're just going to go over indications and contraindications for traction. So indications: nerve root impingement, disc herniation, spondylolisthesis, intervertebral foramen shortening. So the intervertebral foramina is shortening, and that can lead to nerve root impingement as well. And then you got DJD, and then you have joint hypomobility. So if you have any of these indications, you should use traction. Could be cervical, could be lumbar. It depends on patient to patient. And then over here we have our contraindications. So acute sprains and strains. If you have a strained muscle or a sprained ligament, you don't want to be pulling on it because it can make it worse. Acute inflammation, once again, if your body's already trying to heal from something, you don't want to be pulling on it. Fractures, if it's broken, definitely don't want to be pulling on it. Peripheralization of symptoms, so that's when during the treatment they start getting the symptoms down their leg or down their arms and it gets worse throughout the treatment, then you don't want to do that. Or if they've done it before and that happened, don't do it. Pregnancy, you don't want to do it. And when they're pregnant, because they're already going to be more flexible, and so you could end up having these, you could end up causing sprains and strains. Prior surgical stabilization or decompression. If they've already taken steps to help decompress or stabilize that area, you don't want to be messing with that already. The same thing as if it was fractured or unstable. And then spinal implants, prosthetic discs, same thing here. If they've already have something to take care of it, you don't want to be messing around with it too much and causing it to pop out of place or causing those implants to move too much. So these are the indications, contraindications, and for traction. All right, for cervical, I'm going to be using this machine. And so it's already at 20, 30 degrees, which is, we'll put them in cervical flexion whenever we begin traction. So I don't have to worry about them being in 20, 30 degrees. But for cervical traction, you want them in 20, 30 degrees of flexion. So this will do it automatically, and I can increase the flexion by pushing this and then raising up, but I won't do that just because I need it like this. For this, what I'm gonna do is down at the bottom it says release, pump, and hold. I'm gonna pump it up until about 7 or 10 for those black numbers because this is their first visit. You want to get it up to 20 after they are used to it, but to start with 7 to 10 pounds of pressure for about 5 to 10 minutes, and then we can increase as we do this more often. All right. Hi, my name is Kyler Edwards from Rocky Mountain University, here with Jack today. I am a physical therapy student, and I'm going to be practicing using cervical traction for our patient Jack over here. So Jack has a herniated disc C5, C6 with cervical radiopathy, and so we're going to do some cervical traction. Hi Jack, how's it going?
Doing all right.
Doing good?
Yep.
All right. So my name is Kyler Edwards, physical therapy student from Rocky Mountain University, and today I'm going to be going through your treatment today. And so what I want to do is cervical traction. You ever had traction before?
Nope.
Okay. So really it's quite simple. What's going to happen is you're going to put your head right here, and then I'm just going to have you look up at the ceiling, and then on this dial, looks like a tire pump, so, but here at the bottom you can see it says release, pump, and hold. What I'm going to have you do is when you're comfortable, and I'm going to strap this onto your forehead just to make sure you don't move. And then I'm going to have it place it on pump, and then we're going to pump it up like a tire pump so you can see it moving up. And we're going to pump it up until we reach about 10 or so, until you feel like a stretch in your neck. It doesn't have to be painful, I just want you to feel the stretch. And then what we're going to do after that is we're going to hold it for about 5 to 10 minutes, as much as you can tolerate. And then whenever you're ready to be done, and you'll be holding this by the way, and whenever you're done, you can just go to release and I'll bring it right back down. Okay? So are you willing to try that today?
Sure.
Okay, cool. All right, so what I'll have you do is go ahead and lay down on your back, putting your head right here. All right, so it looks like I'm gonna widen this up for you. There you go. Just relax. This should not pinch, but it should feel nice. Should feel snug.
Snug.
Okay, snug, not too tight though, not
Nope.
painful. All right. So here you go. Don't go. I have it already on pump, but don't pump quite yet, so I'll just strap you in. Alright. So got any more plans for the day?
Not after this.
Same. I'm glad you're here to see my first try.
Oh yes.
Yep. We gotta try
Exciting.
on somebody. Glad it's you. Alright, not me. Alright, Jack, whenever you're ready, go ahead and start pumping until you hit that 10. Okay.
And then turn it to hold.
Yes.
Hold.
Alright, you feel that stretch?
It's a little stretch.
A little stretch. Perfect. Alright. So I'm just gonna let you lay like that for about 5 to 10 minutes. Like I said, if it gets too painful and uncomfortable, go ahead and release it. But when you release it, don't stand up quite yet, just because your neck is used to being stretched out. So just lay there for a couple of minutes after you release it. And if I'm not back by then. But if you want to release it and you remember, just ring the bell and then I'll come over. Okay?
Understood.
Alright, I'll be back. Alright, Jack, how was it?
It's doing all right.
Doing alright? Alright, well, you can go ahead and release it. Your time is up.
That's a good stretch.
Alright, so just lay like that for a little bit. I'm gonna get this off your forehead while you're waiting. Alright. Oh, sorry, Jack. So, while we're just waiting for you to get a little comfortable, how do you feel now? How does it make you feel?
It's feeling better.
Feel better? On a scale of 1 to 0 to 10, how does it feel?
I'd say about a 3.
About a 3? Okay. Well, that's good. I'm glad we could get that pain down a bit. Alright, I can go ahead and take that pump, and then whenever you're ready, you can go ahead and sit up, and I'll just be right by in case. Alright, still feeling good?
Feeling good?
Alright, well, we'll see you next time.